Very good evening and a warm welcome to today's Sunday evening talk. So today's session is in collaboration with the renowned AIG Hospital, and we have experts who will guide us on cancer awareness and how to protect ourselves from cancer. And why so? October is Breast Cancer Awareness Month, and we must know that in India every year 11 lakh cases of cancer are detected. And there are, among other reasons, some reasons can be lifestyle mediated and can be avoided. To know more about this, how can we prevent cancer, let us have our experts. We have with us Brother Ajay Varun Reddy Garu. He is a senior consultant surgical oncologist at AIG Hospital. Let us welcome Brother Ajay Varun Reddy ji. And I would also like to call on stage Dr. Nanditha Garu, who is a radiation oncologist at AIG Hospitals. With a round of applause, we welcome our esteemed guests on stage. Dr. Ajay Varun Reddy Garu has over 10 years of experience in surgical department at leading hospitals across the country. He has experience in general surgery as well as oncological surgery, and he has been trained at the world-renowned Tata Memorial Hospital. His area of expertise is esophageal cancer, stomach cancer, and other gastrointestinal cancers. And Dr. Nanditha, she is a radiation oncologist and is currently practicing in AIG Hospital. She did her studies at Nizam's Institute of Medical Sciences in 2012. Notably, she has done her graduation with 13 gold medals and is very keen in the research of radiation oncology. So we would like to know more about how we can prevent cancer as a journal layman and what we can do in our daily lifestyle to prevent it. So over to you, to our experts. Thank you so much.
A very good evening to all of you. Om Shanti. It's been wonderful just for the few minutes that we've been in this campus. It's like an oasis in the desert. I didn't really know that there was a place that was so peaceful within the city. I think I will be visiting this place more often. So today we'll be just sharing a few things that common people should know. A lot of you are from some kind of a medical background as well. You may already be aware of a lot of facts. And being in this organization, a women-led organization, I think it's very relevant that we talk about cancers that are specific to women. You yourself are probably practicing all the right things and have the right lifestyle, but there may be a lot of other members in your community, in your family, who you can spread the word to and increase awareness about this. So we'll go stepwise. So just a few things. What is cancer? What are the common types of cancer in women? What are the signs and symptoms? Can we detect cancer before the actual symptoms start? And how do we prevent it? So how did cancer actually get its name? Now, when you look at the sun sign cancer, you see a crab. So if anyone has seen the way a crab walks, it kind of crawls through the sand. So cancer is very similar to the way the crab moves. It eats through the tissue. And that's how cancer got its name way back in 400 BC. Hippocrates coined this term. So whenever somebody uses the word cancer, it's sort of a taboo word. It's almost like a word that you shouldn't use. But the only way that we can overcome it, try and detect it early and prevent it, is by talking about it and by spreading awareness. So what exactly is cancer? Now, cancer is basically a cell where something has gone wrong in its mechanism of multiplying. Now, every cell has a mechanism to multiply and grow. Now, this lies in its core where we have the DNA. And when there's a small random accident within that DNA, the cell loses control over multiplication, and that results in it rapidly multiplying and becoming what is called as a tumor or a cancer. Now, the cancer, which is originally only starting in one place, it gradually grows in size within that own tissue, as well as it can spread through tissues which are close to it, and sometimes it can enter the bloodstream and go to a different part of the body as well. So that's when you say that the cancer has spread. So how common is cancer, and what are the common cancers that are specific to women? So if you look at this pie diagram, you can see that it is common. There are 19.3 million new cases diagnosed every year, and unfortunately 9.9 million deaths world over from cancer. Now, among that, if you look at males and females separately, the common cancers in male are lung cancers, prostate, and bowel cancers. In women, breast cancer is the commonest. Now, the other cancers in women also include lung cancer, bowel cancer. But what is specific is cancers of the cervix, uterus, and ovary. So these are the cancers that are specific to women, and we'll be talking about these today. And Dr. Ajay will tell you about the other cancers common to men and women. So breast cancer, like I said, commonest cancer in women in the world, also commonest cancer in women in India. And nearly 1.5 lakh women are diagnosed with breast cancer every year in our country. And unfortunately, 70,000 women die of it, which means for every 2 people getting diagnosed with breast cancer, 1 person will possibly die of it. And this is very much in contrast with the West, in the US and in Europe, because cancers get picked up much more earlier than in our country. Only 1 in 6 women diagnosed actually die of the cancer. So what are the risk factors, or what are the things that put you at risk of developing breast cancer? So there are certain things that you cannot change. So the first thing is gender. So we know obviously that females are more at risk of breast cancer, but men can also have breast cancer. They are not exempt. Age. Now, with increasing age, somebody seems to be very surprised in the audience here, but men can also have breast cancer. Increasing age, like it increases the risk of any kind of health problems, also increases the risk of breast cancer. But young women also do get breast cancer occasionally, which is why they also need to be aware of signs and symptoms. Genetic factors. So some people carry a particular fault in their genes, which means that within the family, multiple aunts, their mother, their grandmothers, you can have multiple people in the family having certain types of cancer, such as breast or ovarian cancers. Family history, even if they don't carry the gene, if somebody in the family, let's say a mother has been diagnosed with breast cancer, there is a slightly increased risk in the daughters. Another thing is menstrual history. So women who achieve menarche at a very young age, let's say at 9 or 10, and they continue to have menstruation until a very late age, let's say beyond 50. So this long period of menstruation as well increases the risk. But like I said, these are things which are natural to us. There is nothing we can do to change it. So just be aware of it. Now, what are the things that we can change or are within our hand? Now, not having children is actually a risk for breast cancer. However, I'm not saying just to reduce your risk of breast cancer, you need to have children. Again, it's just something that you need to keep in mind. And also when you decide to have children, try and have the first child at an early age, under the age of 30. Not very early, but not very late as well. Alcohol and smoking, like it's an evil that increases the risk of several things, also increases the risk of breast cancer. Obesity, so people who are quite large and have more body fat, their hormones are a little bit abnormal, and that increases their risk of breast cancer. Also, people who are taking hormone pills in the form of either oral contraceptive pills or hormone replacement pills for a very long time, that also increases your risk. So what are the signs and symptoms? Now, the most common sign of a breast cancer is a lump in the breast. Usually it's a painless lump, which is quite hard. Sometimes you can have retraction of the nipple, or you can have an ulcerated lesion, and sometimes it just gets picked up on a mammogram. So we advise that women have a mammogram regularly after a certain age. I'll be talking about it sooner. So when you don't have a lump and it gets picked up on a mammogram as a very tiny lesion, it can be treated very, very easily and potentially cured as well. So early detection, there are two key factors to aid early detection. One is to have screening mammograms, and the other is to have a breast self-examination. So a mammogram is basically a simple X-ray of the breast. Now, screening is known to reduce the risk of death from breast cancer by over 20%. Because, like I said, when you pick it up early, the risk of it spreading elsewhere or coming back in future comes down significantly, and your chance of cure and going back to a normal life is very, very high. Now, we usually recommend that women start having mammograms after the age of 40 or 45. You need to do it once every year until the age of 54, and beyond that, once every 2 years. So, make sure you make that appointment with your doctor and go and get a mammogram done, either for yourself or based on your age, for your parent or grandparent or aunts, etc. So, breast self examination is also a method by which you can identify something abnormal with the breast yourself. Now, there are 5 basic steps. The first step is to stand in front of the mirror with your arms on the hip and try to feel for a lump in all the different directions. Now, if you find that there is anything very hard in the breast, if there is some discharge in the nipple, now these are the things that you need to show to a doctor. However, all lumps in the breast are not cancerous lumps, so there is no need to get too worried about it. Generally, young women, especially around the time of their period, they might notice something lumpy in their breasts. All that is not cancerous. But if you are doubtful, if it's persisting, if it is hard, then you should see your doctor. Now, the second step of breast examination is to examine with your arms raised, because sometimes a lump becomes more prominent when it's raised. And then step 3 and 4 are to notice the same changes while you're lying down. And step 5 is to do an examination while you're in the standing position. So I can talk about this in a little more detail if you want separately. So now that we know what are the signs of breast cancers and how to pick it up early, we also need to know about what are the steps we can take to prevent this from happening completely. So the first thing is obviously physical activity. And like I mentioned, if you decide to have children, try to have the first child before the age of 30. Breastfeeding is also known to significantly reduce the risk of breast cancer. So when you do have children, breastfeed them at least for 6 months. And obviously to avoid alcohol and smoking. That goes a long way to prevent a lot of health problems. So how much of physical activity is the recommended physical activity? So aerobic exercise, which means running or brisk walking, 150 to 300 minutes per week is what is recommended. You also need to do balance training 3 times a week. So some kind of mild weights or dumbbells will help. And also exercises such as yoga or Pilates also improve your balance. And muscle strengthening and things like yoga, tai chi, or meditation in general, which is exactly what you do, is a very, very important part of exercise. So apart from physical exercise, mentally as well, you do need to unwind and relax, because a lot of internal changes, chemical and hormonal changes do depend on stress, do depend on anxiety, and mental relaxation is very, very important. So I think you've at least got that one box ticked. So what about food? So what are the recommended food? Again, a plant-based diet is something that is recommended. So if people do take non-vegetarian food, again, try and avoid red meat. You can stick to eggs or chicken if you do want to consume any non-vegetarian food. But a vegetarian diet is very, very protective. So 2/3 of the plate should generally have vegetable, fruit, grains, and beans. And 1/3 can be a protein. So that could be protein like paneer, tofu, or it could be non-vegetarian protein like fish. And antioxidants and fiber should also be a major part of your diet. So if you look at all the colorful vegetables there and fruit, generally those which have a lot of color have a lot of antioxidants as well. So berries, nuts, brightly colored vegetables in general, they have a lot of antioxidants. Sugars as well. Now, natural sugars that we get from milk and fruit are what is recommended, but avoid processed sugars. They are something that contributes significantly to adverse health. Now, alcohol, again, like we said, alcohol causes a lot of problems, causes problems with your stomach, with your liver, and also can increase your cancer risk. So, occasional alcohol is still okay, but what is the recommendation is that you can have up to 2 standard drinks in a day for a man and only 1 drink for a woman. Now, why this difference between men and women? This is not some kind of discrimination. It's just that the women's livers can probably handle less than men. But if you don't drink alcohol, then don't start. The next advice is about smoking. Smoking definitely increases your risk of multiple cancers of the mouth, cancers of the voice box, the lungs, breast cancer as well. And if you look at the picture, the first white and pure looking lungs are for a person who has never smoked. The second picture, the pink part is whole lot of abnormal cells in someone who smokes. And in a person who regularly smokes, only 4 to 10% of their cells are normal. The rest are all abnormal cells just waiting to transform into a cancer. And if you quit smoking, so ex-smokers, if you quit smoking, then quite a bit of your lung does recover. And about 20 to 40% of your cells do come back to normal. And what are the reasons to quit smoking? So there are a lot of my patients who say that I've already got a cancer. Why is there a need for me to quit smoking now? So that as well has its own benefits. It helps in increasing your chance of cure. It reduces your risk of recurrence. It helps you tolerate treatment well, reduces side effects, and reduces a second cancer. Sometimes when you're cured and treated of one cancer, the effect of the smoking can some years later give you a second cancer as well. So it's not that if you have cancer once in your lifetime, you will not get it another time. So if you have done everything by the book, you have had a healthy lifestyle, you don't drink, you don't smoke, but you still unfortunately do get diagnosed with cancer, there is treatment available, an excellent range of treatments which are non-toxic as well. Are available these days. Now, one of the main types of treatment for breast cancer is surgery. Some patients require chemotherapy, some require radiotherapy, and some require hormone therapy. The types of breast cancer surgery are mastectomy, in which the entire breast needs to be removed. Now, this is not required for all patients at all. It's only required when a breast lump is very large. And most patients, however, can get away with the second type of surgery, which is called lumpectomy. So here only the abnormal part, which is the lump, can be taken out. And you also need to test for something called lymph nodes in the underarm. Now, removal of a breast is often something that's associated with a lot of taboo, and it affects a woman's body image. A lot of women get very depressed when you ask them to undergo breast surgery. And with that fear, they don't even come out and tell you that there is a lump in the breast just because of the fear of losing their breast. So even this has a solution. There are multiple options of breast reconstruction, which basically means plastic surgery. This can be done to maintain the size and the shape of the breast externally despite having a cancer surgery. So always discuss this option with your doctor. Now, chemotherapy essentially means giving anti-cancer drugs through your veins. Sometimes there are also chemotherapy tablets available. Now, traditionally, chemotherapy does have temporary side effects. So one of the commonest side effects is hair loss. Apart from that, you can have sores in your mouth, you lose your taste. You can also have problems with, you may not be as sharp in your work. It's called as chemo brain. But most of the effects of chemotherapy are temporary, and they do come back to normal once the treatment is over. And one of the ways to reduce hair loss as well during chemotherapy, this is another novel technique which has come in the last few years. It's called as scalp cooling. where you place a cold cap on the scalp during the process of the chemotherapy, and this prevents the hair loss in up to 50% of women. So it reduces the chemotherapy from going into the hair follicles. Radiotherapy is a way of delivering X-rays, high energy X-rays, to the area that has a cancer. And this is often done after a patient has surgery in order to reduce the chance of the cancer coming back. Now, this again has become very advanced these days. There are very advanced techniques available with very minimal side effects. So that was all about breast cancer. Now coming to the next common cancer, which is cervix cancer. So cervical cancer basically is a cancer of the lower part of the uterus, which is the womb that carries the baby. So cervix cancers are very common. There are over 5 lakh cases diagnosed all over the world, and more than 1/5 are diagnosed in India itself. So India is one of the commonest countries where cervix cancer is diagnosed. Now, risk factors for cervical cancer generally includes having multiple sexual partners, and all of this is actually caused by a particular type of virus, which is called as a HPV virus. And the HPV virus, again, this is something that enters the body through sexual contact. So even if somebody is married and has been with just one person, you still can have this virus. So there is an advantage because it's caused by a virus. There is also something that you can easily do to prevent cervix cancer. The signs of cervix cancer, generally it causes abnormal vaginal bleeding. So if a lady has finished her periods and then suddenly she starts bleeding, or if a young lady is having bleeding in between periods or very long periods of bleeding, that could be a sign of cervical cancer. Also, foul smelling vaginal discharge and pelvic pain that is lasting beyond the period as well is something that needs to be checked out. Now, there are 3 very simple steps to prevent and reduce the chances of cervical cancer. The first is you can have a vaccine to prevent this. So we've all had vaccines for COVID, and children get vaccines from the time they are born as part of the immunization schedule. And very soon the cervix cancer vaccine will also be incorporated into the pediatric immunization schedule. But at the moment it's available for you to buy on your own and administer this to your children under the guidance of a physician. The second step is to have a regular pap smears as well as a HPV test. So just to tell you a little more about the vaccine for cervix cancer. Like I said, cervix cancer is caused by a virus called human papillomavirus. So, and about 80% of cervix cancers are due to this particular virus. So there are 3 different vaccines available in our country. One is called Cervarix Gardasil, and very recently our own Indian vaccine, which is called Cervavac. Now this is supported by the government, produced by Serum Institute, and this is available at a very, very low cost. Now, the government has taken a very good initiative of trying to incorporate this state-wise, and this vaccine needs to be given to children. Even though cervix cancer develops in an adult, the vaccine has to be given to children between the ages of 9 to 14. So when your daughters are between the age of 9 to 14, you need to give them these vaccine. If they have missed that time period, up to the age of 26 as well, the vaccine can be given. And the number of doses differs slightly. If you're under the age of 15, 2 doses are enough. If you're over the age of 15, 3 doses need to be given. The cost of the foreign vaccines is between 4,000 to 5,000. But the Indian vaccine now is possibly available at only 500 rupees. And soon, within the next few years, this will be given as part of the immunization schedule along with all the other vaccines. So apart from getting the vaccine, once you get a vaccine, that's not enough. So you do that when your child is at that age. But after you cross the age of 25, you need to have regular pap smears. So all women should have regular pap smears. So this basically is a 2-minute test. You go to your gynecologist, and what they do is they will just scrape out some cells from the cervix and send it to the lab. Now this can pick up precancerous cells several years, 10 to 15 years before it actually develops into a cancer. So you can pick this up or prevent cancer years before it actually occurs, and that can then be treated if those abnormal cells are found. So how often to get a pap smear? Like I said, you start at the age of 25 and you can stop after the age of 65 if all the previous pap smears are normal. And if you are doing a pap smear along with the HPV test, so this your doctor will be able to tell if it's available at that center. The test method is essentially the same. It's still just a 2-minute test. And if they do both of these together, you can get the test done once in 5 years. But if they have the facility only for a pap smear, so some of the smaller centers will have only a pap smear, then you do it once every 3 years. So that was about cervical cancer. The next is endometrial cancer. Now, if you go little above the cervix, you have the body of the uterus. Now, the cancer that develops in this part of the uterus is completely different from the cervix cancer. This occurs mostly in older age group, usually above the age of 60, but again sometimes can happen in younger age group. And the most common symptom of endometrial cancer is post-menopausal bleeding, which means once the lady reaches menopause, that is a period stop completely, if after a few years even a small drop of blood is seen, she has to be tested to rule out this particular cancer. Now, if you do go to a doctor with these symptoms, the common test that they do is an ultrasound, and they will look into the uterus with a hysteroscope and take a biopsy. Now, biopsy is something that is required to diagnose any kind of cancer. It basically means you take a tissue from the tumor and you send it to the lab, and they will confirm that this is indeed a cancer. Now, ovarian cancer, the ovaries are just lying next to the uterus on either side. That is where the eggs are actually produced. This as well is a cancer that causes a lot of deaths because it's very difficult to detect this cancer. The symptoms are very vague symptoms, and so nobody actually thinks that this is likely to be a problem, and it gets picked up in very advanced stages. So what are the signs and symptoms? You can have just abdominal or pelvic pain, increase in the abdominal size or bloating, because often a lot of fluid gets accumulated in the abdomen from ovarian cancer. You can have a lack of appetite and feeling full. So you might, when you look at the person looks very bloated and fat because there is actually fluid in their abdomen. But the person will actually tell you, I have no appetite, I'm not eating at all. The moment I eat a little bit, my stomach gets filled up. So that is one of the typical features of ovarian cancer. And sometimes they just have a lot of fatigue or tiredness. Now again, if you do go with such symptoms, the gynecologist can ask for a simple ultrasound test and a blood test called CA125. Now these two tests play a very crucial role in identifying ovarian cancer or ruling it out. So they are very simple tests, so this can be done even in a diagnostic center. And then if they do have some kind of suspicion, they go to do other tests like MRI, CT scans, etc. So that was all of the theory of cancer in women. Just to summarize the steps that we talked about. So cervical cancer vaccine, give this to your children between the age of 9 to 14. Pap smears, do it from 25 years onwards and then do it every 3 years. Mammograms to check for early signs of breast cancer start from 40 to 45 years of age. And the common symptoms of breast cancer include a breast lump. The common symptom of cervix cancer is excessive bleeding or white discharge and pain. Endometrial cancer, the commonest sign is postmenopausal bleeding. And ovarian cancer can present with symptoms of bloating and abdominal pain. So this basically summarizes everything that I've spoken today. If you have dozed off or you have not paid attention, then this one slide will give you the idea of what I talked about. And this is just an initiative that we are starting soon. This is our breast cancer survivorship group. Now, women who are diagnosed with breast cancer go through a lot of emotional and psychological trauma, and this is often something that they cannot discuss with their family. So, we are starting a support group, or rather a survivorship group, which helps these women get back on their feet and helps patients talk about their own experiences with each other, as well as along with professionals. And our first meeting is on the 11th of October. So if there's anyone in your family or your community who has been through breast cancer or who's undergoing treatment, please do ask them to attend. I think they will benefit from this. And with that, I conclude. This is our team, our small team at AIG Hospitals. Do visit us. We do have a separate breast and gynae health department, and you're welcome even if you just want to come to make yourself aware of the things that we've talked about today. Thank you. Any questions? So the same vaccine, now out of those 3 vaccines, the imported one, Gardasil, they do give it even up to the age of 45. But the efficacy of the vaccine is said to be very less beyond the age of 26. So it's unlikely that it'll help too much, but it won't cause harm. So if somebody is keen on taking it beyond 26, they can. The key is that the vaccine should be given before marriage or before the first sexual contact. So if that happens, then beyond that, the efficacy of the vaccine comes down.
Suppose you detect something in the pap smear.
Yeah.
Can you really cure that person of a potential risk of cancer in the future?
Yes. So there are different stages to the evolution of cancer. It goes through a process where you have low grade changes, and then you have intermediate grade changes, high grade changes, and then finally it develops cancer. So when you do find these low grade changes, there are multiple procedures that you can do. So there are some laser techniques or cauterization techniques where just that abnormal tissue can be ablated and prevent it from developing into a cancer. So that is the whole idea of getting a pap smear done. I think Ajay will do that bit in the general cancer awareness. Okay, so if there are no further questions, I'll hand over to Dr. Ajay.
Thank you so much, Nanditha, and thank you to all of you gathered over here, spending your time in the evening. Some of these things would definitely have slipped your heads. Some of this would have retained, but the general key points were the same. Talk about cancer a lot, like what people used to talk about diabetes, hypertension. Now it's a disease that is well established. Cancer is not a taboo. So talk about it more. There's no shame about talking about it. Discuss your family members with your family members what you have heard. Discuss the myths. Only then you'll know what the facts are. Second thing is cancer preventive methods. Just hardly few things. Vaccination, stop smoking, live a healthy lifestyle. So those key points, if you can keep in mind, that's more than sufficient. Anyway, to what sir was asking about male cancers, my intention was not to talk about male cancers. I knew that Nanditha would do a very good job in elaborating what the general causes are and at least what gynecological and breast cancer is about. So what I wanted to do is share some of my experiences, share my perspective as a cancer surgeon, so that I also know your perspective when you gather over here in such a nice way, in such a positive way to spread happiness all around. So I'll start with 2 stories. So the first one, so in March of 2020, a 30-year-old male probably came from Oman. He was a pharmacist over there. So when he first came to our OP, he had a huge dressing in the groin region. So groin region is the region between your thigh and the stomach part. That is the groin. So huge dressing over there. He used to say, "Doctor, I change my dressing every day twice. There is a large wound over there." So usually cancer surgeons don't get general wounds or something. They have already a diagnosed case of cancer. So the first thing is he did not tell me that there was a cancer. He told me, "Do something for this." So when I opened that, it was in fact a large tumor that had fungated or eaten away the skin, what you call. Some of those pictures which Nanditha had shown were in fact the better of the pictures. So this one was around 15 centimeters. His skin was completely red. It was eaten away. It was as if, like the crab that she described, it had all eaten away. So he took, in fact, some time to come out with it. He was not very frank about what had happened. So finally, he said that he was a pharmacist in Oman. He had a small swelling over there. Just to save money, instead of going through the regular hospital, he went to a local doctor. He did a small drainage of that. And after this became a bigger lesion. It was later found that it was a squamous cell carcinoma of the skin. Not very common, but can happen. And definitely not very common in his age. He was in between 20 to 30 years, between that age. So finally he ran home. He wanted help. He had roamed around many different hospitals in the city. They all told him, we have done our scans. It has infiltrated the main blood vessels that go into the leg. Not much can be done about this. The only option is we have to chop your leg off. When in fact, even my opinion was the same. I told him we'll have to go for an amputation. An amputation is cutting off a member of your limb. So he said, sir, I've heard this multiple times. I want to hear something different. So I told him what the science is. I told him we are not here to satisfy you or anything. We have to look at the scans. We have to be very frank with you. I empathize with what you're feeling. I know it's a difficult decision, but please do something. So what we have something called as a tumor board discussion. So what 2 or 3 surgical oncologists, we sit together along with the radiation oncologist, the medical oncologist. We all sit, we have a discussion on the scans. We try and deliberate what our experiences have been with such rare cases. So one of the pointers that came out was, of course it was close to the blood vessels, but there could be a chance where we could try and save his limb. It was going to be a risky surgery, one. Second, there was no guarantee with these things. And you have to try and understand that most of the times when we counsel patients and when doctors meet patients and patients meet doctors, we ask for guarantees. Okay. They want to know, doctor, is my limb going to be saved or is it going to be removed? Give me clear cut white or black. In fact, that is not how medical science is. And in fact, that is not how cancer science is at all. We run on probabilities. We'll tell them the probability of survival, the probability of recurrence and all that. Patients don't understand it. More so, even doctors don't have a hang on it. They have been taught that way. They tell that same thing to the patient. So it just becomes a mess when you try and talk to patients in these terms. So basically, now the situation was that we had a way to save his limb, but there was no clear-cut way to explain to him that the risk of amputation still was there. So there was a 30% risk that during surgery, his limb have to be chopped off. And he has to take that decision before surgery because we cannot wake him up during surgery and ask him. Okay, so he went back home. He came back after a week. He told me, sir, what is your opinion? I told him, see, at some point in life, or these are the times when you will have to take a choice. What is your choice? Your choice is to live with cancer and you had been given probably 2 months to live. So that clearly is not your option. The gruesome option and also the good option is to take your limb off. You are at least going to live. Why not take the chance? We are going to involve the best specialist in the hospital. Maybe after you wake up, maybe your leg may not be there. I cannot guarantee you that. Just take a chance. If it was me, I would have taken that option. Fine, good enough. He agreed. We had an 8-hour long surgery. The vascular surgeon was involved. We could save that limb. Finally, he went back home very happy. In fact, that is something that in most centers would have written off as we'll have to cut the limb. Reasons being, patients will not accept if you give them probabilities. Second thing is, no one has time to talk to them so much and convince them. This was those rare instances where he was a pharmacist. He understood some bit of medicine. He was able to come back again and again, pester me and try and tell him that I'll take the chance. Okay. So 2 years down the line, he came for follow-up again and again. He was doing fine. He did a lot of physiotherapy. He started walking again. Then after 2 years, he stopped coming. So I knew that this patient was there because some patients you tend to not forget. So suddenly after 3 years, he came back. So 2 years he was in regular follow-up. 1 year he lost follow-up. 3rd year he came back. He came and said, sir, I feel there is some problem. I was having a good life. Now I have some pain. So do your tests and figure out. So we did a PET scan. Unfortunately, I had hoped that beyond 3 years, usually cancers don't come back. But unfortunately, he had a cancer recurrence in the lung. I was feeling it very difficult to counsel him because after all this, after having gone through a huge major surgery, living through 2.5 years of regular follow-up, on the 3rd year or 4th year, he develops a recurrence. But the first thing he came and told me, he has already seen the report, he understood the report. He told me, sir, till 30 I have lived one way. After this surgery, for those 3 years, I have lived in a different way. Whatever I thought I will live, whatever I thought I will do, I have done in these 3 years. I know what you're going to tell me, I am in acceptance of this. So this is the kind of interaction that we have every day. He has gone for chemotherapy now, he's still doing okay. But I know for a fact that once the tumor spreads in other areas, there's hardly much that even we can do. But the best thing that the patient had towards his is, he lived his life for the past 3 years in the way that he wanted to. He did not lose hope. He is not going to lose hope until his last day. And that is the best treatment, or probably the best kind of palliation that we can give. So this is story number 1. Story number 2 is about a 65-year-old elderly lady who came around 6 months back. She was from Karnataka. She had a political background as well. So she came, got evaluated, had some difficulty while passing stools, found out to be carcinoma of the rectum. Very positive people. From day one, they are like, okay, sir, cancer is there. We know that treatments are there. I know doctors are the best. You will do the best. So we'll just follow whatever you say. So she had to get radiation first. She went for radiotherapy and chemotherapy. So that is a cycle of 6 weeks. After that, we have a waiting period. Then we repeat a scan. Then based on the chemo and radiation, her response was moderate. Then the obvious next step we know is to go for surgery. So when they came back to me again for surgery. So now while talking about surgery, again they were very positive. The only thing is, sir, we know that we have to get surgery. We have already read everything up. Our family also has done doctors. We are not scared of surgery, nothing. But the tricky part about rectal cancer surgery is, so rectum is that part of the intestine where the last part where your stools go and come out. So in that part, whenever you operate in that part, if the tumor is little higher up, you can cut it and rejoin it without much problems. If the tumor is little lower down, what we call as a mid rectum or a lower rectum, once you cut it and rejoin it, if you have solid stools passing through it, you always have the risk of rupture over there. So this is a standard practice in most centers that we do a temporary stoma. Stoma is nothing but temporarily after surgery, you divert so that the stools come out in a bag. If the tumor is even lower down, then you will have to do a permanent stoma. So as usual, as my training was, we have to tell each patient who has a low rectal cancer that they probably are going to get a permanent stoma. And definitely a temporary stoma, because temporary stoma, definitely we do it. Permanent stoma in those cases where the rectal tumor is very low. This I told the patient, and for some reason, all the positivity just went away. She said, I am willing to die, but I don't want a stoma in place. That is the kind of taboo that she has had. All through, when she had come, she was not scared of cancer. She was not scared of recurrence. She was not scared about chemotherapy. This small social stigma that she is going to have a bag which is going to collect the stools changed the entire thing. She was willing to go without surgery, risk her life without all this. So I told her, think about it for 1 week. Speak to whomever you want. Come back to me and I will tell you what my perspective is. She came back again. This time she was crying literally. She told them, sir, I am okay with whatever kind of surgery you do. I don't want a stoma. What can you do about it? I told her, at least a temporary stoma you will have to get done. She said, for temporary I am okay. For permanent I cannot do. I showed her all the previous testimonials of people in the internet having stoma, living their normal life. Not convinced. She says, sir, I am the Jayaprada of my time in Karnataka, during that place. How will I go out for a social gathering? And as a doctor, you don't think about all these things. Frankly, you're taught a science, you see multiple patients, you gain your experience, you can't cater to those small social fabric kind of perspectives where if someone wants a stoma, someone doesn't want a stoma. Science doesn't work like that. Same thing I told her. You have one good shot to lead a healthy life. Don't lose it just for this kind of social stigma. I know you're strong because I have seen you all the way throughout the treatment. She came back the next week. She told me, sir, I have prayed hard for you not to feel tense during surgery, and I know this is going to work. That's what she told me. She has not prayed for herself. I don't know if she prays also, but she has prayed for me that I don't do the surgery. Surgery went on fine. She did not require even a temporary stoma. For those reasons, sometimes the sigmoid is redundant. Just God's way of trying to save those people who have the positive mindset. Now, what I want you to note in this is, it's not only the patient's anxiety in all this. There's a bit of doctor's anxiety as well. And in fact, that is true for all the different kinds of professions or businesses all of you must be going through. Health is not just physical health, as you all know, it's mental health. And we are not just biological machines that we just go on for 70 years, 80 years, and just inevitably. The one good thing about life is you all know it's going to come to an end. So those are the two set endpoints between which you have to work. And how you work within it is just based on what kind of relationships we make, how we treat our physical self, how we treat our mental self. And when I just entered this campus, I was surprised to see that within this concrete jungle, at least there was a place that you could have some bit of mental peace. This is something that most places are not concentrating on. If you open Instagram, there is an ad every day about a gym or someone who has built muscles. No ad about some place which is giving you some kind of mental peace. It is going to go, because with the youngsters who are there here, I'm pretty sure they'll put up all Instagram messages on this also. But I hope for a future where mental health is given as much, or in fact more importance than physical health. I hope for a world where the need for doctors is not there at all. I just wish you all the best. And if you have any questions about our experiences, you can ask. About medical aspects, definitely you'll find it on internet. But if you want to know how we think, what kind of patient experience we've had, if you had any doctor experiences, what they would have gone through, what the doctor would have thought, we want to spend the next 15-20 minutes on that. Thank you so much. Please ask your questions.
Hi sir, good evening.
Hi.
My name is Pavan. Actually, I'm an acute myeloid leukemia patient. Maybe last March I completed my treatment. I'm just doing good. But okay, I don't have any, maybe madam told all things like about the lifestyle, all these things. I won't smoke, I won't take alcohol. I'll go for walking for 7 to 8 kilometers. Everything went well. Maybe my age is around 42 years. But still I got this AML, acute myeloid leukemia, last June. I just went for random test. I just went for a sugar test, and casually my cousin has told me to undergo CBC. So by evening I came to know the white blood cells are very abnormal. So when I went and met Apollo, they just said to admit and to undergo the chemo, all these things. It went very well. But I don't know, maybe, yeah, I just keep asking to the doctor also, what is the reason behind that? Even though I'm maintaining all good things, maybe even that mental health also, I used to do some balance. Only some office stress will be there. Other than that, everything is fine, but still I got that. The thing is like, is there maybe food also? Maybe I won't take outside food. Everything is done as per the information in the internet or wherever maybe. So, but still I got that. So maybe food habits, because everyone will say, even I will be attending these kind of sessions in offices, wherever I see some in the internet, I used to attend the webinars, all these things. But everyone will say that food habits are the main cause for these kind of things. But one question, sir, maybe even I'm a son of a farmer. I know a lot of chemicals they're using to grow the vegetables, but we cannot avoid them because I keep talking to them, but they said to get the good number of yield or something like that, they used to do a lot of pesticides in the things. So it is the main reason for these many rise of the cases in the cancer side. Maybe food, maybe everyone is saying about food, but maybe government is not taking right precautions, but still a lot of most cost effective things are they are spraying on the vegetables where we used to grow. We cannot change. Even I cannot change that process. So in food habits means like now we are hearing about organic food, everything in the market. I don't know whether it's guaranteed that they grow that food without chemicals and all. It's not sure also. Still, maybe food habits, whatever there in the market, we are taking that from the supermarkets and we are consuming it. So is there any chance to avoid or give any thoughts from your side, from doctors panel? Maybe you said you learn from science, but still any help can be given for us. So
anyway, sir, it's a good thing that you come out in the open that you're a cancer survivor. Many people don't even talk about it. That is the first thing. Second thing is that this is invariably a question, even if they don't ask the doctor or outside, every patient feels the same. Why me? Why did I get it? They told me not to smoke, I have not smoked. They told me not to eat non-veg, I have not eaten. Why did I get it? In fact, no one knows the answer to it.
Yeah, so, in my 1 year
so how many ever talks we give, it is for those 5 to 10% of cancers where we know there is a cause. And cause definitely is not a 1:1 cause. Definitely, as Dr. Nanditha said, if you smoke, your chances of getting lung cancer are more. It is not that you will get lung cancer. If you drive on the wrong side of the road, your chances of getting into an accident are more. Not that you will get accident, but will you drive on the wrong side of the road knowing this? You won't. But the fact is, these facts are only for 10% of the cancer. And the cancer that you are saying, we still do not know the cause. Why someone? No one knows. In future, will we know? No one knows. What is the solution? What is the way forward? Now, there are some things in life which are inevitable. Like, for example, however hard it may be for me to say, you know that there are some times in life where we face such things. These are going to affect both our physical health, mental health, and our family health. When you know that these things are happening all around you, there is some sort of insurance that everyone gets it. Like, for example, some friend's family suddenly expired. Their family did not have much finances. They have done a health or life insurance. You also get kind of things. What happens when you have cancer? You're destroyed mentally. You're destroyed physically. The most that you can do is to live or treat your body in the best possible way till that occurs. If it doesn't occur, good. Till that occurs, and keep your mind in the best possible way so that you can deal with the consequences later on. See, my only thing is sometimes I tell most of these cancers are like accidents. If someone lives for 1,000 years, definitely they will get cancer. Just that most of us don't live that long. 70 years, someone gets a heart attack, someone gets cancer, someone has a road traffic accident. These are just accidents of life. And trying to find reasons for all accidents of life is to just waste the life that we are living in. So have a positive mind all through, even if you have a rare diagnosis or a diagnosis. It's very easy to say, but sometimes it's extremely hard. That's why support groups like this are very, very important. The last slide which Dr. Nanditha put is a cancer survivorship program. Not many institutes are bothered about it, in fact, because there's no money in it. Okay. But that is the main thing that actually supports patients after their diagnosis. They get diagnosed. There's always a fear, will my cancer come back? There's always a fear, will my daughter also get cancer? No one knows the answers to all this. There's a support system. That is why these support systems are slowly coming up. But to answer your specific question, there's no reason, no one knows about this. There are very specific cancers which we know the reason about it. And to make people act on it also, it's become a big headache. They know that lung cancer is related to smoking, but not everyone follows it. And for cancers which we don't know the cause, God only knows. What about family history? Yeah, family history is very important. But what can you do about a family history? You are already born into that family. You cannot change. Some things you cannot change. The things that you can change, please do change.
Hi. So many times we have read the articles about like if you make your body alkaline, so it reduces the chance of cancer. The cancer cell doesn't propagate the way it propagates in an acidic body. Can you shed some more light on that? Because we are not really aware about what an alkaline body means and what sort of food should we eat, or is it like the people write about it? So
In fact,
how true
what
is
you're
it?
saying is probably just an extrapolation of a very specific laboratory finding which someone must have found, and it is not true. First of all, trying to say it is like saying if you eat more sugar, cancer cells will grow, and this is a common thing that goes around in our cancer clinics. So patient comes and says, "Sir, can I eat everything?" I'll tell them, "Yes, you can eat everything." Again, he'll ask, "Sir, can I eat everything?" Then outside he'll go and say, "Sir is asking me to eat sugar also so that I get back cancer, so that he can treat and get money." So it is not like that. Okay. So what happens is cancer cells in the body behave differently from cancer cells in the lab. So cancer cells are just like any other cells, but function abnormally fast. So they divide fast, they take up energy fast, they take up sugars fast. So
also important in the blood.
what is important? Hemoglobin. Okay. So what you are saying, if you put a cancer cell in an acidic medium or an alkaline medium, just like any other cell, it is not going to survive. If you put the cancer cells in a sugar medium, it is going to proliferate much faster. Doesn't mean that your body is the same as a laboratory petri dish. So all these things are actually false. So only thing that has evidence is some of these risk factors which she has described, which you should follow. Okay.
Sir, one question. Sir, you are saying one case study that 65 years woman passing stool problem. You are testing that large intestine and small intestine.
Large intestine.
You are checking large intestine and small intestine. On that basis only you get the result.
What? Yes, it is a large intestinal tumor. Question, Telugulo అడగండి పర్లేదు.
No. When you cure large intestine and small intestine, the cancer will be killed automatically.
I didn't know the question. Question ఏంటి?
क्वेश्चन है मेरा, लार्ज इंटेस्टाइन और स्मॉल इंटेस्टाइन बॉडी में अगर बराबर वर्क कर रहा तो कैंसर सेल को जनरेट करने नहीं देता. कई को बोले तो अपने बोन मैरो से नए नए सेल्स तैयार होते रहते हैं. वो जो डैमेज सेल है उसको किल ऑटोमेटिक कर देते हैं.
ऐसे कुछ नहीं है, मतलब क्योंकि हम लोग हर दिन एक 10-15 दिस थिंग लार्ज इंटेस्टाइन स्मॉल इंटेस्टाइन कैंसर्स तो देखते ही रहते हैं. जो कुछ भी लिखा है बट देखे तो हम लोग है ना. सो ऑल ऑफ देम दे कम नेचुरली. समटाइम्स थोड़े people they tell they have eaten red meat, that's why they have got. Some because they have smoked they have got. Some because they have done something they have got. Unless we find a 1:1 relationship, I cannot comment and give you a recommendation. उतना ही है. इतना तो पता है कि स्मोकिंग करेंगे तो लंग कैंसर आने का रिस्क बहुत ज़्यादा है.
सर आई एम च्यूइंग टोबैको, इज एनी प्रॉब्लम?
माउथ कैंसर आने का बहुत.
माउथ कैंसर नहीं, मेरे को माउथ कैंसर नहीं आता बोल के बोले हमारा डॉक्टर. कई को बोले तो मेरे को है ना कफ और कोल्ड का प्रॉब्लम है, आपको माउथ कैंसर नहीं आता बोल के.
डॉक्टर भी खाता है क्या वो?
नहीं, वो आयुर्वेदिक डॉक्टर है, पंचरत्न डॉक्टर बोल के. वो पास्ट में 20 ईयर्स बैक उसके पास गया था तो उन्होंने बोला, मेरे को गारंटी दिया उन्होंने, सर्टिफिकेट दे बोले तो देता बोल के बोला.
लास्ट ओरल कैंसर जो मैंने देखा था क्लिनिक में वो डॉक्टर ही था. ही वाज अ आरएमपी डॉक्टर. आएगा. बंद करो बोलने से बहुत दिस थिंग है, तो स्टार्ट मत करो रोमन, बट वंस यू हैव स्टार्टेड बंद ही कर.
पहले बहुत खाते थे, अभी 5-10 पे आ गए.
फिर भी आएगा.
नहीं आता. हमारे खून में है ना होमोग्लोबिन 14,000 है. मैं वो होमोग्लोबिन है ना, जो भी रॉन्ग सेल्स है ना उसको अटैक करके उसको डिस्ट्रॉय कर देता हूँ.
कुछ भी है ना हो आप में तो पॉजिटिविटी तो है.
थैंक यू फॉर द कॉम्प्लीमेंट.
ठीक है. एनी मोर क्वेश्चंस?
Can you tell something about prostate cancer enlargement and how that is?
So prostate cancer is actually a cancer of the men which is very common, and very the thing is, I'll tell you something about prostate cancer. It's a very slow growing tumor. Prostate, I know many people may not know. So once you drink water, your kidneys filter the urine and goes to the urinary bladder. Urinary bladder is like a bag to hold the urine for some time. So once you get the feeling of passing urine, you pass urine. So in males specifically, between the urinary bladder and the outlet, the urethra, there's a structure called as a prostate gland. The main function of the prostate gland, usually during semen production or something, it secretes a fluid that lubricates the thing. Also, it is there at the doorway of the urethra. So many times what happens is, patients in old age, patients come with urinary problems. they say that it is difficult. So very common, very, very common. They tell that they have to pass urine very often. They'll have to get up from sleep very often. They cannot completely void the urine. Some 5-6 ml will go, again they'll have to go. So these are all signs that prostate has been enlarged, some sort. Benign prostatic hyperplasia is a very common condition again. That means it is not cancer. Naturally, the prostate gland in older age, beyond 70, it grows very large. So benign prostatic cancer, benign prostatic hyperplasia causes obstruction urine. In some of these cases, what happens is, some of these patients, very small percentage of patients, there could be a cancerous element to this prostate. Now the thing is, the good thing about prostate cancer is very slow growing. And by the time you detect it, it's usually in the 70s. So these cancers go over the next 10 years or 20 years. So how we treat usually these patients is, during diagnosis, the age is very important. If you diagnose in a very young patient or 50s or something like that, you go on quite aggressive in these treatments. You do an MRI, you do a PET. If it is not spread, you do surgery and then you remove the thing. If same thing you detect in an 80-year-old patient, you better not touch that patient. Because by the time the tumor grows and actually causes problem, he'll be 100 years. And you know in India, no one lives up to 100 years. So in your exact question, usually in foreign countries, what they do is they do a PSA evaluation. That is a blood test. PSA evaluation. So if you do a PSA evaluation and the level of PSA is extremely high, that is a surrogate marker that you can have some problems in the prostate. In some countries, they do it as a routine. In India, we usually don't. But usually in many general health checkups, that is also included.
So the PSA, is it directly related to that prostate, or is it general kind of say?
PSA basically tells you the volume of prostate and the amount of that enzyme that is released by the prostate. So the bigger the prostate or the more cancerous it is, the more the PSA value. Very extremely high PSA values definitely mean that the prostate has to be evaluated properly. It could be cancer. Mildly elevated can be found in BPH also. Is there a specific question regarding a family member or something?
No. Actually, I got prostate enlargement, which is recently when I went for testing. They said they taken ultrasound scanning. In that they found it, but it is PSA is normal, but so nothing.
It could be BPH or something.
Yeah, nothing. So PSA is normal and prostate enlargement was there, but
that is okay, unless if it's causing too much problem with enlargement, the urologist usually does a procedure to enlarge the.
So that is normal later.
Yes.
I consulted another doctor. He said it is age related. So I could not. It is not possible to reduce the size of the.
Yes, as I told you, this is BPH and not prostate cancer because the PSA is not.
Okay, thank you.
So inguinal hernia is it something similar to this whatever he said, whatever is it?
Inguinal hernia is not a cancer problem.
Okay.
Inguinal hernia is a medical problem. It's basically some weakness in the abdominal wall, stomach wall. So basically your stomach wall has muscles. Beyond skin there is muscles. So they act like the compound walls for the organs from not popping out. Sometimes there is a weakness in some area. Inguinal is inguinal region.
Yeah, that
So sometimes when you cough or something, whatever inside abdominal intestines are there, they pop out and then go in. That is an inguinal hernia. It is not cancer related.
Yeah, this enlargement it can be distinguished from prostate enlargement, right?
Prostate is a totally different organ. The inguinal hernia is in a total different place. Prostate is in a different place. There is no way to confuse both of them. इंसुलिन क्यों इंक्रीज करना है इंसुलिन? अच्छा, शुगर को कैसे कंट्रोल करना है बोल रहा हो ना? एक्सरसाइज करते हो आप कितना किलोमीटर? और अभी शुगर टैबलेट पर हो? देखो, एनी जनरल शुगर मैनेजमेंट, इफ इट इज बॉर्डरलाइन शुगर, एक्सरसाइज फर्स्ट. उससे नहीं हो रहा है तो टैबलेट्स आते हैं. उससे भी नहीं हो रहा है तो बाहर से इंसुलिन प्रोड्यूस करना है. खुद से इंट्रोड्यूस ऐसे होता नहीं है. अभी हुआ तो अच्छा है, होता नहीं. ऐसे इंसुलिन खुद से जब नहीं है. नहीं है सर.
Sir, I have a question here. Yeah, I have a question here. Like, what lifestyle we should follow so that we can reduce the pro- 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 probability of a cancers, like any type of cancers.
See, there are some cancers where obesity is a risk. And the reason why obesity is risk is multifold actually. There is no point in going into the details. For example, an example is endometrial cancer. If you are obese, what happens is some of the hormones like estrogen are increased because of peripheral conversion. And that's why it causes. Without going into the scientific details of it, definitely some obesity related cancers are there. So how much exercise a person do? There's no hard and fast rule. Even if someone tells you a hard and fast rule, you know that it is just based on the body type. For someone, 20 minutes is sufficient. For an obese person, 1 hour might be sufficient. But every day, some sort of activity is required for any sort of person, for your body to work properly. It will help you not only in decreasing your weight, it will also decrease the risks of these cancers, and also other, more importantly, lifestyle diseases like diabetes and hypertension. I know we are talking about cancers, but don't forget diabetes, hypertension and all those diseases, because they are definitely linked to the amount of exercise you do and how obese you are or how fit you are. Half an hour, 20 minutes to half an hour is your answer. Okay.
Good evening, everyone. Here, can I go? Okay.
మళ్ళీ చెప్పండి సార్. ఓకే, ఐ విల్ ఆన్సర్. మేడం మీ క్వశ్చన్ కూడా చెప్పండి.
Question is actually, it's a very interesting and challenging discussions going on right now. I am coming from the background of medical billing and coding from USA. It was a very short-lived career for me there, and I know the background is so much that we know so much of negativity with everything that is there with the disease, right? Now, how does a disease really occur? It occurs because your body has got a lot of toxins in your cell membranes. Am I right? So if we really see from that angle and from that perspective, I'm not at all biased with any kind of sciences. Allopathy is at the place of allopathy, and when we have to take a strong decision, we have to really go for allopathy too. Surgery also is needed. When it is needed, it's needed. Maybe homeopathy is also another alternative, and Ayurvedic may also be another alternative. But recently I have been at the Vijayawada ashram of Dr. Mantana Satyanarayan Garu Arogyalayam. I stayed there for 6 months as a translator and helped all the sadhakas to get the knowledge what Razugar is giving every day from 7 to 8:30 in the campus. From what I understood from his lectures is this: there is a process of autophagy through which any kind of cell membranes will really rejuvenate and cure you from diseases. So this is the basic idea that I really got. And luckily tomorrow is like 2nd October, and he's inaugurating a session on the YouTube where he's going to give with the English subtitles of all the different recipes which could be a remedy, maybe 10%, maybe 25%, maybe 35%, as you want to follow the diet restrictions or that lifestyle, you can get the knowledge. That's what I wanted to share with all my friends. Thank you.
Thank you so much, man. Sir, మీరు అడిగిన దానికి it is not true like that. Okay. So just doing surgery for BPH doesn't cause cancer. Sometimes it can be that once you do surgery for BPH, in the tissue when they send it for examination, cancer may be detected, but that is not the cause. It might have been hidden inside, and just because of this surgery it has come out. That's all.
Hi sir.
Yeah.
So many times we hear the news about viruses and diseases in chickens and goats. So how how real is it? Do we really catch some viruses and diseases while for eating them? So should we quit eating non-veg or something?
So definitely all of you, avian flu and all comes from chicken only, but in cooked meat usually the chances are low. But definitely if someone wants to be overcautious, it depends on what you want to go. There's no recommendation to say that if once you have eaten cooked meat, you get anything through that. There are other diseases definitely. There are a lot of diseases. Like for example, cysticercosis, worm diseases. Viral disease is one of them. Livestock like live hen and all sometimes catch these diseases and transmit to us. So when you cook it or something, it's usually the chances are less, but it doesn't go to zero. Everyone doesn't cook it the same way. So if you want to be safe, you can eat vegetarian.
Hi, sir. One more question. Does gastritis leads to cancer in the long term?
Actually, there are varied reports, but I'll tell you a general rule about cancer. Any tissue that is irritated for a long duration of time usually tends to proliferate faster. The gentleman who was asking about eating pan, you're irritating the mucosa of the mouth. Basically, what happens when you irritate it with any sort of, it is not pan, anything, you put chemical, you put something and you go on eating a tissue, it dies, new cell is generated. It dies, a new cell is generated. Or the existing tissue starts proliferating faster to accommodate for the loss of tissue. When you have so many number of cell divisions, the chances that something can go wrong in that increases. That is the core cause for oral cancer as well. There's a chronic inflammation that goes. Inflammation as in there's a process that happens. Cell death occurs. Sometimes there is neutrophils that come in. It is as if there is some injury that is going on occurring in one point of time. The chances of cancer increases. Gastritis is a form of injury again. Chronic gastritis usually can cause to some sort of cancers. Gastric cancers essentially. Chronic gastric irritation can cause gastric cancers. But usually there are good treatments for gastritis now. And also there is a cause for gastritis which is detected, a sort of bacteria called as Helicobacter pylori. So along with your Pantocid, they also give a course of antibiotics in most hospitals. So that is the answer. So regarding madam's question about toxins, so see, there are a lot of things about these agricultural toxins and all when you're talking. A specific example is aflatoxins. Okay, in Rayalaseema, the kind of farming practices they do, the kind of storages they do, especially for groundnuts. So a kind of fungus grows. So that fungus produces aflatoxins. And that aflatoxins, in fact, again affect the liver. Now, these are broad guidelines which government has to impart. Now, you can't prevent a person who is hungry from eating food. It is life and death versus prevention of cancers years later. So obviously you can't ask him not to eat the grain that is being produced because it's unhealthy or unhealthy. Healthy or unhealthy, he is going to starve otherwise. So only when government makes such policy decisions, trying to keep these basic science facts. See, what happens is people do experiments in the laboratory. They bring out papers. Then it comes to the doctors. Doctors treat 1 or 2 patients who come. It's sometimes the government's responsibility to do these policy decisions where there are broad-reaching consequences. Like you have better storage facilities for groundnuts so that these things. So at an individual level, sometimes it becomes difficult.
Hello. Hi, doctor. So there are a lot of medicines in the industry like antibiotics, anti-inflammatory antibiotics and such kind of things. And you can also take vitamins to not get vitamin deficiency. So are there any drugs in the market which are kind of anti-cancer drugs, or if they are not there, like how many years would it take for the pharmaceutical industry to come up with something like that? Do you have any idea or estimate about that?
There are no ideal anti-cancer. You're talking about prevention of cancer, right?
Yes.
Or treatment, prevention. So there are no well-defined anti-cancer drugs per se. So what happens is in the lab someone discovers that if you have a deficiency of vitamin E, some sort of cells proliferate more, so it can lead to cancer. Now that fact is taken by a pharmaceutical company. Now they start propagating that you start taking more of vitamin E or C. There's no harm in taking vitamin C more. If you want, you can take. But by taking that, are you decreasing the chance of cancer? Till now, there is no evidence like that. Basically, to say that you have a balanced diet at your house, don't deprive yourself of essential nutrients. Your body has all it takes to fight cancer. Because, mind you, your body by itself is trying to fight all the defects that happen naturally. So, every cell, when it divides, sometimes if there's a defect, your body will try and fight it and kill that cell. So beyond all this, if some cell escapes, then only you will get cancer. So keep your body strong, keep your immunity strong, because they are constantly fighting from you not getting cancer. Your body is your best defense, and treat your body well. That's all. ओबिसिटी वालों में एक्चुअली व्हाट हैपेंस इज देयर हमारे बॉडी में ऑलरेडी एंजाइम्स होते हैं, थोड़े एंजाइम्स. वो एंजाइम्स एंड्रोजेंस, ईस्ट्रोजेंस और प्रोजेस्टेरोन ऐसे एंजाइम्स जो है, फैट सेल्स में एक तरह का एंजाइम होता है जो एंड्रोजेंस को ईस्ट्रोजन में कन्वर्ट करने के लिए, वो है फैट सेल्स में. जैसे जैसे फैट सेल्स इंक्रीज होते रहते हैं, इवन दो ईच फैट सेल कॉन्ट्रीब्यूट्स वेरी लिटिल वो ईस्ट्रोजन के लिए, ईस्ट्रोजन का लेवल बढ़ जाता है. सेम थिंग, ज़्यादा ईस्ट्रोजन, इफ समवन टेक्स लॉट ऑफ ईस्ट्रोजन ड्यूरिंग ओसी पिल्स और समथिंग लाइक दैट, देयर इज अ हाई रिस्क फॉर एंडोमेट्रियल कैंसर. वही ऐसे ही है, वो वाला कैंसर आ जाता है. प्यूरिफाई मतलब क्या? वो तो है.
Okay.
वो तो है.
Sir, since cancer treatment is very costly and you have diagnosed many patients, so does health insurance helps them?
Yeah, definitely health insurance helps, and sometimes even doctors can't afford the treatments that are there today, which is a fact. Okay, what happens is see all these latest cancer drugs, not the general chemotherapy, the immunotherapy and all that you talk about, after having spent thousands of crores abroad, a pharmaceutical companies gets that drug out. Sometimes these drugs, they just cause marginal benefit, that's all, but still they don't want to accept that marginal benefit. It is put out in trials, there is a paper released, they say that there is evidence. We'll make you live 2 months more. Are you willing to accept that or no? That is the punchline. Anyone who is in their right sense will say even 2 months is enough, I am going to take that treatment. But what happens is, with all that money spent in research, finally it boils down to the patient paying it. An individual patient cannot afford all that because all these are patent protected. India is a signatory to protect these patented rights. So Indian government also cannot intervene and reduce the cost of this. Eventually what happens? The end loser is the patient. So having a health insurance definitely helps. So everyone should get a health insurance, at least in today's modern medicine. Just for cough, cold, it did not matter, but these kinds of treatments are expensive. उनको भी पैसा बनाना है ना. Yeah, thank you so much.
Thank you so much, Dr. Ajay, Doctor. And what we really learned is there are many aspects and many variables. Some we can control, some we don't control. And like Dr. Garu said, even they have to face situations where they are tense and they are also anxious how to counsel the patients. But in the end, it's like beautiful stories that you shared. I think they were really heart-touching and inspiring, like having a positive mind, how even the way he framed God's way of helping people who have a positive way of mind. So that is something we can inculcate, healthy lifestyles and also a positive frame of mind. And appreciating spaces like these inners are Shanti Sarovar, which are an oasis of peace, happiness, trying to give you those elements which we are missing in the daily life. Thank you so much to both the doctor experts. And the way the conversation has progressed, it actually shows there are many misconceptions also, some confusions, which they have very rightly cleared out and they have tried to make us aware. And I think these sessions are really required, like you said, in these current times when cancer rates are increasing. So on these lines, we will have a short meditation on a song which will inspire us to, while we are really thankful to the services doctors give, but we also remember the Supreme Soul and the Supreme Surgeon to also guide our doctors and also give us strength to face through the different challenges of life. So we'll have this short meditation on the song, and next Sunday, the topic would be on physical literacy. Dr. Garu, both of them really highlighted how physical fitness is important. So the next session, next Sunday, would be a workshop interactive session on physical literacy by Dr. Amit Malik, and he is actually very much involved in highlighting and creating awareness about different aspects of physical literacy. And he has also given his consultations to Pullela Gopichand Academy and also Dronacharya Awardee, Coach Ramesh. So we wish all of you attend. Come with your children, family members, because the session is open for all. And we will have a short meditation now. And after that, we'd like to also give our appreciation, a short token of gratitude from Shanti Sarovar by Didi to both our experts. So thank you so much. Om Shanti.
हाँ, डॉक्टर के साथ परम पिता को भी तुम याद करो। डॉक्टर के साथ परम पिता को भी तुम याद करो। दुख दर्द के पिंजरे से अब खुद को आजाद करो। दुख दर्द के पिंजरे से अब खुद को आजाद करो।
डॉक्टर के साथ परम पिता को भी तुम याद करो। दुख दर्द के पिंजरे से अब खुद को आजाद करो।
Such an informative and interactive session. It was not cancer, as you were saying, it is tabooed word, but nowadays it is open, which is very good. But nowhere it was like cancer awareness, but it was more interactive, and you made it so easy and so, I can say, energetic that no one felt it is something serious. So first of all, thanks to both the experts for this wonderful talk. As both of you mentioned about how the our daily routines or our mental health we have to keep up, so that everything, whatever comes, we will face it with much grace and ease, which is very important. That is where mental health meditation helps, which you mentioned here we are helping. And at the end, we played the song, very beautiful song, very old song of Brahma Kumari's, Doctor ke saath Parampita ko bhi yaad karo. Because Parampita wouldn't make us feel from all the disease, but what he helps, how to go through that process with much ease and much peace. And taking that as a challenge and facing that challenge with more energy and courage. So that is where meditation also helps. So we encourage everyone to practice meditation. It is good not to go to hospital, because that is what doctor also mentioned. We don't want you to come and see actually, because free from disease is very good. But in case it is there, then early detection, prevention, everything is very good. So prevention is better than cure. So that is where Brahma Kumari is also helping to prevent mental diseases, physical diseases as well. So you all enjoyed? Yeah? So in Sunday evening talks, you are getting more this kind of inputs, not only for your spiritual upliftment. Spiritual upliftment only happens when your body also is healthy. Otherwise, you cannot focus on meditation also. So that is why we are having so much of medical talks also, and taking that forward, as sister was mentioning about Dr. Amit Malik, who is he has done his PhD in this subject, physical literacy. He is working with many governments across India, especially doing this part of what are the activities or our festivals, which are like Batukama is there, which we are going to celebrate. A lot of physical things is involved. So all these things will be mentioned in that talk also. So this is especially with families. So no Bala Brindavanam that day, even the children also will be here. Family activities will be there. Okay? So thank you once again, and we welcome both of you onto the stage. And a small token of love and appreciation from Brahma Kumaris. Yeah, please come.
Brother Anil and Brother John, we'd also invite you for accompanying the team for this beautiful awareness session.